up to my phone ringing at about 1 o'clock in the morning. I turned over to look who was calling, and on the screen it said vet hospital. I already knew what the call was about. When I answered the phone, he said someone was bringing in a heifer that was having trouble calving, and if I could meet him at the clinic in about 10 minutes. As I jumped out of bed and changed into the proper attire, I started to tingle with excitement because I knew I was going to get to assist in my most favorite surgery, a cow C-section. Veterinarians are qualified people whose profession is to care for the health and well-being of your animals. By caring for your animals, they also take care of the well-being of people. I will now inform you on the reasons for a C-section and the steps it takes to have a live and healthy animal at the end of the process. In an interview with Dr. Shonda Stallings, a doctor of veterinary medicine from Hallettsville Veterinary Hospital, on January 9, 2015, we discussed the process of a cow C-section. To begin with, a cow or heifer is presented with a dystocia. Merriam-Webster Dictionary on January 9, 2015 describes dystocia as a difficult birthing process, which can happen for many reasons. The veterinarian will vaginally palpate the cow to see if the calf can be pulled or if a C-section will have to be performed. Once they determine that the calf is too big or the mom is too small, then a C-section will take place. The cow is laid over on her side with her head and her feet tied so that the vet will be able to cut into the abdomen. Once laid over, the cow will be sedated to reduce movement during the procedure. The vet tech will then clip and surgically prep the incision site with an iodine antiseptic to make sure the area is sterile and bacteria-free. Then the vet will locally block the incision area to reduce the cow from feeling the cut. After that, the vet tech will surgically prep the area again to make sure that the C-section is ready to take place. From personal experience, Dr. Stallings and I both agreed that at this point, you are thinking of everything that you need to do right and also everything that could go wrong. And most of the time, it will come to the point of, wow, this cow really hates me. So now it is time to begin the C-section. The vet will glove in and sterilely put a drape on the incision site. They will then take their scalpel blade and make an incision cranial to the hip bone. They will begin to cut through the skin and then the muscle until they have about 1 foot of area of an incision site into the abdomen. From here, they will put on long sterile gloves which will allow them to reach down inside the cow and find the uterus. By finding the hock of the calf, they will exteriorize the uterus so that they can make an opening on the uterus along the calf's leg. Once the uterus is cut, the calf will be grabbed by the legs and pulled out of the cow. Now it is time for my most favorite part of the C-section. This is where I actually get to glove in and help with the procedure. From here on out, it is my job to hold the uterus while the vet sutures it up. I also clamp the sutures with hemostats so that they will have a tight stitch. Once the uterus is closed, we will flush the outside of the uterus and the abdomen with the iodine antiseptic to kill any outside bacteria that may have entered during the process. After flushing, the vet closes the muscle layer first, following with the skin layer. And then the C-section is complete. The worst feeling is when you try to stand up after and your back hurts so bad for bending over from what seems like 100 hours. Here, we will give the cow a strong antibiotic to prevent any infection and also a shot for pain and inflammation. Working with the calf is also a must to make sure that it is breathing correctly. Most of the time, we will feed the calf colostrum, which is the mother's first milk, so that we know the calf is set until it is able to stand on its own. Now I will move on to the reasons why a cow or heifer will have to have a C-section. In my interview with Dr. Shonda Stallings, she stated that the normal gestation period of a cow is 9 months or 280 days. In this time period, the fetus moves where the nose and the feet will point to go out first of the vagina. As you can see in this picture, the calf is in normal position for a normal delivery. The most common cause of dystocias in cow C-sections is cow-fetus disproportion. This means that the cow is too small to have the big calf. Other causes include abnormal position of the fetus in the uterus, an incomplete dilation of the cervix or vagina, a set of twins, or a deformed fetus. First-time heifers are at most risk for a C-section. Most of the time, their pelvis or birth canal is not matured enough to have a calf. According to Virginia State and CHAPA, or Cow-Calf Health and Productivity Audit, on May 1, 2009, the studies indicate that dystocias are responsible for 33% of all calf losses and 15.4% of beef cattle losses. Now I would like to show you a photo from a C-section from a day in the life of a cow vet from Dr. of Veterinary Medicine, Carrie Telgen, on December 5, 2013. As you can see from this picture, it is a quite interesting process, and this is why it is my most favorite experience. Overall, C-sections are a surgery that is performed when a cow or heifer is unable to have a calf correctly. As stated before, this is because of disproportion or birthing defects. Although C-sections are a more extensive process, they will keep your cows alive during an unnormal birthing process. Veterinarians are there to help you and your animals stay healthy and well. They want what's best for your animals. Veterinary medicine is my passion, and C-sections are my most favorite surgeries that I will never forget. And I know that if you have a love and passion for something, you will never forget your most memorable experiences.